Usually, it depends. Usually, vaginal delivery is still indicated. It's not, I mean, having bacterial vaginosis or vaginitis is not enough for us to recommend C-sections. It also depends on what microorganism is there. But usually the answer will be it's okay. The thing is that we will treat it. Especially, we have to know that the colonization by certain bacteria might be normal for the women, but not very, but it could be harmful for the baby. For example, now it's routine to make a culture of the rectovaginal area of pregnant women in the 36th or 37th week of pregnancy, just after birth, so we know in the delivery, in the birth itself, if we need to put antibiotics. That would be just the only consideration that we might have. Vaginal vaginal delivery is still recommended. The only thing is that we would use antibiotics just to prevent further infection and disinfection to go to the baby.
There are some recommendations or some guidelines we have that at the final stages in the pregnancy, for example, in 34 to 37 weeks of gestation, we need to treat every vaginal infection, but we can have the vaginal delivery. But if we have the vaginal infection at the 37 or 38 week, we should start antibiotics to the newborn, as Dr. Mesa mentioned, because they are in an increased risk of having pulmonary or even meningitis in the first days of birth.